Hello everyone. In this video, we are going to discuss the parasympatholytic drugs, their classification, their pharmacological action, and the uses. So let's start with the parasympatholytic drugs. Parasympatholytic drugs, also known as anticholinergic drugs. Conventionally, this anticholinergic term is referred to muscarinic receptor antagonist. Nicotinic receptor blocking drugs also blocks the acetylcholine, and they are classified on the basis of the receptor into ganglionic blockers and neuromuscular blockers. Ganglionic blockers block the NN receptor while neuromuscular blocker blocks the NM receptor. Let's see the classification of anticholinergic drugs, that is muscarinic antagonist. So these drugs are classified into three types: natural alkaloids, semi-synthetic derivative, and synthetic compounds. Natural alkaloids include atropine, hyoscine. Semi-synthetic derivative includes atropine methionnitrate, homoatropine, hyoscine butyl bromide, ipratropium bromide, tiotropium bromide. Then synthetic compounds classify into anti-secretory antispasmodic drug, vasoselective, mydriatics, and anti-Parkinsonian. Anti-secretory antispasmodic category include quaternary compounds, tertiary amines. Quaternary compounds are propanthalin, oxyphenonium, clindium, Simetropium bromide, isopropamide, glycopyrrolate. Tertiary amine includes dicyclomine, valthamate, pyrenzapine. Vesicoselective drugs includes oxybutynine, flavoxate, tolterodine, darifenacin, solifenacin. Mydriatics includes cyclopentolate, tropicamide. Anti-Parkinsonian drugs include procyclidine, biperidine, trihexylphenidil. Let's see the pharmacological actions. Pharmacological action of the parasympatholytic drugs are generally opposite that of the acetylcholine. So atropine is the prototype drug of this class. So let's see the pharmacological actions of the atropine. On the central nervous system, it shows stimulation, vagal, respiratory, vasomotor center stimulation, decreased vestibular excitation, and has anti-motion sickness effect, decreased tremor and rigidity of Parkinsonian. High dose causes cortical excitation, restlessness, hallucinations and delirium, respiratory depression, coma. Action on the cardiovascular system, on the heart, tachycardia by blocking M2 receptor. IMSC injection causes transient initial bradycardia. The blood pressure going to rise, but due to histamine release it decreases. In the eye, it causes mydriasis, abolition of light reflex, cycloplegia, photophobia, blurring of near vision, smooth muscles, M3 receptor blockage, relaxation. In glands, M3 receptor blockage, decrease in the secretion. Rise in body temperature occurs due to the inhibition of sweating. It also shows mild local anesthetic effects. Let's see the uses of parasympatholytic drugs. It is used as anti-secretory, antispasmodic in bronchial asthma, COPD, as mydriatic and cycloplegic, as cardiac vagolytic, in Parkinsonism, motion sickness, to antagonize effect of muscarinic drugs. In case of poisoning, it is used. Let's see the drugs one by one. Atropine. It is obtained from the Atropa belladonna, Dhatura stramonium. Tropine is the base present in the atropine. CNS effects are excitatory. At low dose as well as at high dose, it causes excitation. Anticholinergic property is more potent on heart, bronchial muscles and intestine. Duration of action is longer. Anti-motion sickness. Then hyoscine, obtained from Hyoscyamus niger. Scopine is the base. It shows CNS effect depression, amnesia, fatigue, drowsiness, and REM sleep. At high doses, it causes excitation, hallucination. Anticholinergic property is more potent on the eye and secretory glands. It is having shorter duration of action and it show anti-motion sickness activity. Hyoscine butyl bromide used in esophageal and gastrointestinal spasm. Atropine methionnitrate used in abdominal colics and hyperacidity. Ipratropium bromide used in COPD, bronchodilator, inhalational, and it is suitable for regular prophylactic use in perennial rhinitis and common cold. It is used. Tiotropium bromide, it is M1 M3 selective, bronchodilator, newer congener of ipratropium bromide. Propanthelin, it is having ganglionic blocking property. It decreases the gastric acid secretion, so used in peptic ulcer and gastritis. Oxyphenonium used in peptic ulcer and gastrointestinal hypermotility. Clindium used as antisecretory, antispasmodic in nervous dyspepsia, gastritis, IBS, colic, peptic ulcer. Cymatropium bromide used in irritable bowel syndrome. Isopropamide used in hyperacidity, nervous dyspepsia, IBS. Glycopyrrolate, it is pre-anesthetic medication and used during anesthesia, also used in COPD. Dicyclomine, it is M1 selective, smooth muscle relaxant, antiemetic, used in morning sickness, motion sickness, dysmenorrhea, and irritable bowel syndrome. Valethamate, it is smooth muscle relaxant, used in urinary and cervical dilation. Pyranzepine, it is M1 selective blocker, inhibits the gastric acid secretion, used in peptic ulcer. Oxybutynin, it is M1 M3 selective, smooth muscle relaxant. It is used in post-prostatectomy, vesical spasm, neurogenic bladder, spina bifida, nocturnal enuresis. Tolterodine is M3 selective. It is used in overactive bladder. Flavoxate used in urinary frequency urgency dysuria condition. Darifenacin used in urinary incontinence, urgency, frequency. Solifenacin, it is similar to darifenacin. Drotaverine, it is non-anticholinergic smooth muscle antispasmodic. It inhibits the phosphodiesterase 4. It increases the CAMP production and muscle relaxation. It is used in intestinal, biliary, renal colics, irritable bowel syndrome, and uterine spasm. Next is atropine, home atropine, cyclopentolate, tropicamide. All these are used as mydriatic. Atropine is potent mydriatics. Home atropine is 10 times less potent than atropine. It produces cycloplegia. Cyclopentolate, potent and rapidly acting mydriatic. It is used in iritis, uveitis. Then tropicamide, it is quickest and briefest acting, used in fundoscopy and refraction testing in adults. So here we see the anticholinergic drugs, mostly muscarinic receptor antagonist, their classification, their uses, pharmacological actions. If you like the content, press the like button and subscribe for the more.